Good. Well, I can't see Sanjeev on the screen.
It will, the speaker only come on the screen.
Okay.
A very good afternoon on this Sunday. We welcome you for this session on tennis injuries and prevention by Dr. Karthik Kailash. I wish to invite Mr. Ajit Bharadwaj to introduce our speaker and proceed with the session. For any question or queries, please write on the chat box, or those who are following on the YouTube channel, again comment on the chat box. We are going to be answering your questions one by one. And if wish to directly interact with our speakers, please join with the Zoom ID and password. We'll be connecting with the speaker. Thank you. Ajit sir, please.
Hi, good morning, friends. This is Sunday morning, and I'm Ajit Bharadwaj from Delhi, play for 60+ Indian team, and I'm glad that in COVID-19 we are connecting to you in a different way, and it's a blessing in disguise that if we were normal, maybe we wouldn't have thought of this. So we explored the idea that we should connect and meet on this Sunday morning, and we have a great panel of tennis players and a great tennis player, as well as a very good doctor and a well-named in his profession, Dr. Karthik Kailash, and he is joined by a good panel of players like Mayur Vasant, Sanjeev Kasal, Rakesh Kohli, and our 60+3 of our team is here. So I will introduce one by one. Mr. Rakesh Kohli, he is the chairman of Stag International and sole distributor of Babolat India here. And he is my doubles partner. We play regularly in circuit, and a very good net player. He holds #1 position in doubles for many years in India in ITF ranking and IDA ranking. He was ranked as high as 14 in doubles, which I think any of us have not reached at that level. Then we have Mayur Vasant. You all know he is the one who made all of us proud when he won, when he reached the finals of Helsinki World Tennis Championship a few years back. He has been playing for the last 14 years the senior tennis, and the credit goes to him that he has not lost even a single set in last 14 years in any of the matches he played in ITF seniors in singles. He is a fabulous person, a great friend, and a great tennis player we have seen in senior tennis. He is also a marketing head of Babolat India, and we have none other than Sanjeev Kasal. Sanjeev has won 5 nationals, and he has won 6 of ITF tournaments in seniors category. He has been playing circuit since 1970. He has another passion of broadcasting, and he has covered many senior tennis players as well as the tennis players of younger era who are the top, like Roger Federer, Nadal, Djokovic, Chris Evert, Martina Navratilova, and Mike Anderson. He also was to promote tennis in India. He came out with a show on NDTV called Down the Line, and that show was popular, and he covered good players like senior players like Ramanathan Krishnan, Ramesh Krishnan, Vijay Amritraj, Anand Amritraj, and our favorite Leander Paes, as well as #1 Sania Mirza. So since he has various other accolades, like he was also invited as an analyst in 2010, our Commonwealth Games, which were held in Delhi. He also was nominated as, or he was invited as an analyst in 2012 in Sydney Olympics, as well as he was also there in French Open 2013. So I will use his expertise, his experience to moderate this session. He will introduce you, Dr. Karthik Kailash, and all in the question and answer session, because he is the best person and he can do this job better than any of us. So over to Sanjeev Kasal. Thank you very much. Hello? Oli, am I disconnected or what?
We can hear you, Sanjeev. Can't see you though.
Sanjeev Kasal's microphone, the audio is off.
But we can't even see him.
I can see him on video, but his audio, the icon is showing off.
Oli, can you help?
Even I can't see Sanjeev on screen, so I don't know.
His name is coming as Aisha.
Aisha, but I can't see him on screen.
Ajit, I'm just calling you.
Yeah.
Yeah, we
Yes,
can,
Sanjeev, we can see you
back
now and we can hear you also.
Can you hear me now?
Yeah, we can.
Yes.
Okay. I don't know what went wrong. Anyway,
Your-
as I was saying, good morning, gentlemen, and I hope there's some ladies out there as well. It's a privilege to be here on this panel, and I think we're all tennis lovers. And as Ajit said, it's a good option to exercise, which is doing something like this and using the help of somebody like Dr. Karthik Kailash when we have this lockdown. Because this is a lockdown, not just for the country, it's actually a lockdown for us senior tennis players. Our knees are locked down, our shoulders are knocked down, our elbows are locked down, you name it. So we're pretty grounded and homebound. So it's good that we're using this opportunity to interact with somebody like Dr. Kailash. I was looking at Dr. Kailash's resume, and I have to say that while I haven't known him for so long, though we hit a few balls together in Chennai a few months ago, a very impressive profile in terms of the fact that he's done sports medicine in the US. He's been with the Indian cricket team way back in 1994. He was the doctor against our series, the Indian series against Pakistan, as well as South Africa. And besides cricket, he's also been involved with the ATP event in Chennai with Dr. Paes, Leander's father, as we all know, Wes. So if you look at the fact that he's been a specialist in sports medicine and in a sport which he himself loves and he's passionate about, and we are passionate about, I think we couldn't have chosen a better person to be on this panel and to be our guest today. Because not just tennis, but I've seen that he's also been involved with other sports, as I mentioned, cricket and wrestling and boxing, and currently the head of Shri Chandra University in Chennai, where he's the head of the spinal department and head of the spinal department at Chennai. So somebody who's won many nationals and many ITF events himself, I think we're privileged to have somebody who can help us aging tennis players to benefit by inputs coming from him on how we could prevent injuries going forward and also take care of and repair injuries that are already there. So Dr. Karthik Kailash, welcome to this session, and thanks to Rakesh and Ajit for putting this together. So I really want to appreciate them for doing this. And over to you, Doctor.
Thanks, Sanjeev, and thanks Rakesh and Ajit for helping us meet up each other, even though we're so far away and we're locked in our respective places. And good to see Mayur after so many years away from the circuit. Maybe about 30 years back, we met Mayur some time back, but good to see Mayur again. So I thought we'll just go through some basics and go to a presentation on what various things. Please feel free to stop me at any point of time, so that I don't want this to be a monologue. I would like it to be a very interactive session as far as things are concerned. Okay, let's go on to the first thing then. So most of us know that as good tennis players, we all need to have good agility. We need to maintain balance and control to hit the ball effectively, and we also need a lot of power and strength. And this comes from sprinting, stopping, starting, bending, etc. And the repetitive demands on the bone and ligaments needs that we need to have good muscular endurance. So all these are important for us to be a good tennis player, which all of us have been managing so long until the number gets into our way. So let's take the numbers out. Now, tennis injuries could be usually traumatic or maybe overuse injuries, or most of them. Traumatic injuries usually are related to the lower extremities, and they're not related to particular techniques. Overuse injuries are what we usually worried about. There are 70% of them, and they could be related to a technique or an imbalance in muscular imbalance, which is commonly seen in all of us due to various adaptations. So why do we have these overuse injuries? Tennis is a very, very fantastic sport which needs to perform repetitive, forceful movements and strokes. And then we could also have inadequate rest and recovery. Somebody like Rakesh traveling 10 tournaments, 12 tournaments every year and playing a lot could also have inadequate rest and recovery. Incorrect technique and tennis-specific conditioning, none of us are involved in it. As we grow older, we also become very stiff and inflexible. And this can also lead to adaptation, therefore lead to some injuries. And of course, as I told you before, it's very important to remember that as we age, once you go past 50, you lose about 28% of your muscle tone and strength, as documented by various research. So it means that we develop imbalances in our musculature, and this can lead to various other injuries also. So what are the common injuries which we see in various parts, and why do they have that? So the first thing is, as we get stiffer and as we get older, we find that our body gets rigid. And this rigidity leads to inadequate strength, and therefore various parts of the body gets overloaded. So the commonest parts which get overloaded because of our tennis is the shoulder, the elbow, the wrist, the hips, the knees, the back, and of course, lastly, the ankle as well as the foot. So these are common areas. So what I'm going to do is touch on each of these areas, say what are the common things and what are the various recommendations that we could have. So at any point of time, just stop me, so that we can start talking to each other rather than just me talking all the time. So why does this? This is what I mentioned. This is a very vicious cycle which you have. So when you adapt, we become stiff. As we get stiffer, performance get altered. Altered technique happens because we're trying to reach out for the ball more often, and then we're overloading us, and this leads to an injury. So the whole thing is based on the fact that our body adapts to something which we are not doing, and that's the whole premise on which the overload theory for injuries is all of us on. Now, to put into a small perspective, the injury incidence for us, as per the literature, as per the scientific evidence, is you'll have 3 injuries for every 1,000 hours of tennis you're playing. So, which is quite a lot. So, therefore, it's important for us to remember that we have to, make sure that we are strengthening ourselves, conditioning ourselves to adapt ourselves towards this pattern. Now, going on to the first area. You guys are okay so far? You want to stop and ask anything?
We're fine. We're fine.
So looking at shoulder pain. The most important problem in this is 10 to 30% in the elite and 70% of world class players have this problem. So what are the main problem symptoms or things you have with shoulder? You can have pain, you could have loss of movement or what you call stiffness, muscle imbalance. There are various movements happening. It's called external rotation. It's called internal rotation. So these two things can vary. The external rotation can become more, internal rotation becomes little less. That becomes what we call as GERD, or what we call as an internal rotation deficit in the shoulder. And this actually perpetuates a lot of problems like the subacromial impingement syndrome. What is the impingement? Impingement is when you take your arm across, up and down, you have some kind of a locking on the shoulder because there's something locking or something impinging it. And this is because of the rotator cuff, the four muscles around the shoulder, which actually causes some amount of stiffness. And this can lead to pain. Sometimes you also feel the shoulder popping out a little bit. This is what's called a shoulder instability. And lastly, as we get older with diabetes also along with most of us, you will find that the frozen shoulder is a very common part of it. Frozen shoulder is nothing but where you have movements of shoulder being impinged or restricted. And the simplest way to work around that is to go ahead and then do exercise routines for that. Once we're doing that, you'll find that you're overcoming this. So what are the recommendations we have? So you have to be very certain that you have to get your muscle balance right. The external rotation is good. This is external rotation. And that movement has to be more than internal rotation. And that you have to do it by increasing your flexibility, by working on with your resistance bands or your light weights. Appropriate technique where your forehand follow through has to be complete. And the elbow position has to be at about 120 degrees as far as the toss, and the point of contact has to be reaching out to make sure that you do not have residual problems. Use of resistance bands, lightweight with more repetitions is better as compared to doing heavy weights with lesser repetitions. And range of movement exercise with shoulder, where you take your shoulder to the full movement, like flexion, abduction, and you take it backwards like extension, and the rotations, external rotation and internal rotation. These are various movements which have to be done on an everyday basis to make sure that the movement is not restricted in any form. Now, one of the most important thing is to do stretching exercises and do repetitive exercises. Now, one of the most important thing as far as the shoulder problem is concerned is you have dynamic problem where some of the muscles in the shoulder are not actively working like your scapular stabilizers. So in this case, what happens is you can do push-up exercises like pushing on the wall and making sure your rotator cuff is trained well by using light weights. And what you do is rotation strengthening exercises. And what are those? Those are very simple exercises where you can push to wall strengthening exercises. Rely on it. Use your exercise resistance band to do the pull-outs as well as the pull-downs, and then do lightweight training with your dumbbells or with barbells to improve the strength on the exercise. And most important, make sure that you get full rotation on your shoulder. That's the most important thing to be followed. Next, we go on to.
Can I ask you a question?
Yeah, please, go ahead.
I have a tendon tear, a bicep tendon tear, and a long head tendon tear. I'm still playing, and of course, I'm going through rehab. And some of the things that you put up here on the screen are very much up my street, because that's exactly what I'm following. As a tennis player yourself, can you recommend any change in the service action that one could implement to take the load off the shoulder while one is serving? Because I acknowledge the fact that this is going to be a lifelong issue for me unless I have surgery, and I believe the surgery is a very risky one. What could I do in terms of my service action to reduce the risk of aggravating this injury further and perhaps being more creative in some form on court?
Okay. The main, what time, when is your main pain happening? Is it?
It's on the shoulder. Well, there's not much pain now, but I would say there's a lot of weakness.
Okay.
Not enough strength. I can't serve the ball. I can't serve hard.
Okay. See, the key to that would be mainly when you work on your rotator cuff.
Right.
Okay. Now, the key would be strengthening the rotator cuff and as well as your pectoralis. Once you do that, that'll be fine. The service motion basically, the motion basically consists of a preparatory phase, a swing phase, and then a cock up phase, and then a reach out and extension phase. Okay. Now, one way of avoiding the whole thing is to take it up into a instead of going into a preparatory phase and then the pull through phase, you go directly into a wind up and then into a reach out phase. So in that way, you will find that you're not actually doing a full lot of extension on your shoulder. Okay, this is what when I'm going to take my arm back, I'm going back on extension. Now, most of us have the extension and then we go up, wind up.
Right.
So the reason why we have this is we have what is called as internal rotation deficit. This movement of the shoulder, this is external rotation.
Right.
Okay, and we do this This is internal rotation. Okay. Now, when we do this, we are full. When we do this, we are not full, most of us. Okay. Similarly, when you do this, take your hand behind your back, you will find this and swing through. But if you want to avoid that, you can just straight away go across, lift your hand up, and then do it straight.
Fine. So there's less acceleration, but at least you're less busy with the entire service action. I think I lost you. I can't hear you.
Yes, the loading is not so much. Hello, can you hear me?
Yeah, I can hear you now.
Yeah, intermittently, sir, your voice is going off. Some bandwidth issues.
Sorry?
Yep, probably we're not able to see your video and
Are you able to see me now?
yes, correct.
I can see you.
Okay. Now, we're talking about avoiding the extension. You know, one of the guys who used to do that before, I don't know whether you remember Jaikumar Roypa.
Yeah, I remember. I've seen Roypa. He had a very, if I may say this with all due respect, if you remember his toss, he had a very peculiar toss.
Correct. He had a very peculiar toss because the shoulder was off.
He was playing this men's when I was playing juniors. J. Roypa.
Yes. The thing is that he had his shoulder injury or avoiding the preparatory phase and the.
I can't hear you. Sorry, I lost you.
You can? Can you hear me now?
Yeah, I can hear you now.
Okay. I think something to do with the net probably, a little unstable.
Yeah, possibly
So
the net. Yeah.
That's one part of it. The second part of it is, of course, surgery is the last resort, which I make my living by operating, right? But surgery is the last resort for us. And I don't think you really have to get too worried because if I will use a personal anecdote, I tore my pectoralis major, the main muscle, completely. I had a complete tear. I have the semis, and I couldn't lift my hand at all the next day, but I still continue to play. And it's about 3-4 years now. I've been advised surgery for that. I have not taken surgery, just done shoulder strengthening exercises, and I'm back to playing tennis, almost near normally. So it's not necessary that we all the time we have to look at surgery as an option. Surgery is an option when we decide that your activities or daily living are hampered. If you think that you're not able to manage whatever you're doing on a normal basis, then I think surgery becomes an option. Otherwise, surgery is not an option. For us, playing tennis is almost something which we have to live with. You can't be without playing tennis. So if somebody says don't play, I think that's not an option.
That's true.
Okay. So I think
all of us.
Yeah, I think it's important for us. I think the most important thing is that you look at making sure that you're strengthening that. And the strengthening part of it is, working very solidly on your stabilizers, your shoulder stabilizers. That is something which you do. And eventually you will find that you are able to get back into normal routine. It takes 6 weeks to 3 months to get back onto it. But it takes a bit of time and you'll still be able to get back to it. You'll have the bad days on and off, but I think we have to accept that as part of routine and carry on with that. So I don't think you should action by eliminating
Can't hear you.
We seem to be having an audio issue with Doc because he suddenly intermittently goes off.
Yeah, I couldn't hear. I couldn't hear.
One side. Let me just get another thing organized.
Sure.
And there is, I think, Punar Bhasin who wants to speak, but his hand is up, but his audio is off. So can we request our admin to put his audio on, please?
Sure, exactly. So those who wish to talk, they need to raise the hand. I'll unmute it.
I'm just trying to see if we can go on to another
At the same
internet
time,
source.
there's a request that all the hosts who are there, their audio to be kept on all the time.
Can you hear me now?
Very
Yes,
well.
yes, Doc, we can hear you.
Hello?
Yeah.
I'm back. Okay.
Yeah. You can hear you, Doc.
Okay, now, yeah. We go on to the next one now. So this is one of the other common problems which we all face, tennis
So,
elbow.
Doc, can we wait? Because there is Punar who wants to ask a question on this matter and he's not been able to speak. For
Sure.
Punar Bhasin. He has
Yeah.
been raising his hand.
Sure.
Mr. Mayur, can we take the question answer session at the end? Otherwise, the flow will get disturbed. So we can discuss during the end of the presentation, probably.
Perfect. Okay, done.
Whatever is, it doesn't, I think only it doesn't matter, as long as we have a thing, because somebody who's got a shoulder problem can't wait till the hip is sorted out and then come back to the shoulder. It doesn't matter. Don't worry about the flow of the talk. It doesn't matter. You're used to it. So if you don't mind, can I request to the guy who's got a shoulder problem, when you're talking about shoulders, he can raise issues on that. Not an issue at all.
Yes, admin. So can you please put Punar on? He wants to talk.
Yeah.
Good afternoon, everybody.
Yeah, hi.
Good afternoon, doctor. Since you just spoke about that, that straight position of raising your shoulder and then going on for the serve, a classic example for the gentleman who raised the question also was Andre Agassi. He also had the same problem for about 6 months. And if you see his YouTube videos, few matches, he had changed his action to a direct raise of the arm and then serving. If you see that, I think that is what the doctor is trying to suggest. So even I'm also suffering from the same problem, but though I have not changed my action, but the same rotator cuff problem is with me as well.
Yeah, that's one of the things. You eliminate the extension, or you eliminate the back movement across, and then take it across directly and do it. You do lose a little bit of power in the beginning, but you will find that you will readjust yourself.
Absolutely. No, thank you. That's a very valuable input from you, doctor. I'm going to try that.
Yeah, but don't use it against me. Okay, so we go on to the next most common thing. A lot of us have had this at some point of time, rather when we are playing. So tennis elbow. Tennis elbow.
I cannot hear you, Doc.
Can you hear me? Can you hear me now?
Yes, please.
And am I audible?
Better, Doc.
Hello?
I can hear you.
Okay.
Yes, Doc, we can hear you now.
Now, when you look at, that's good. So when you look at what are the causes of tennis elbow, the causes of this could be inappropriate hitting, or sometimes the backhand technique itself could be a problem, or an overhead could be a problem, and this could be due to a positioning of the arm as well as where you have the point of contact. And the other things could be that the racket could make a difference, the racket weight could make a difference, the handle of the racket, the string tension, and the type of balls we play could also make a small difference in tennis elbow. So typically, if you look at the one-handed backhand technique, when you look at it, the ball contact is far from the fulcrum, and you're trying to reach out and hit the ball. The greater the distance, the greater the fatigue and the problem happens, and greater is your chance of you having lateral epicondylis or tennis elbow. So how do you circumvent that? what actually goes through, which is wrong at that point of time, is when you don't lock your wrist. Normally when you lock your wrist to play, you can do that. So when you don't lock your wrist, there is a loading on the hand. The hand actually twists itself, and there's an increased stress on your elbow with the attachment of the muscles near the epicondyle. And this actually leads to persistent pain and development of pain. So when you're playing single-handed, you learn to decrease the ball racket impact, you decrease the torque on it, and you hold the racket firmly so that the impact is actually generated across and then doesn't carry forward. So in that way, you try to reduce your impact on the racket as well as on your elbow. Other things that can be done in terms of playing, I've also had a tennis elbow for some time, and I've used an external support or a brace, which is you can see it over there. So what does the brace do? Basically, it forms a tight band across thing. I've seen a lot of people wear the brace from here to here. That's not appropriate. What we need to do is make sure you wear the brace from below. The tendon is over here. That's where the tendon is. So you have to give rest on that area and bridge that area. So you put your brace across from below that, and not an elbow cap or like your knee cap. There are people using the elbow support from here all the way down. And that's not the ideal way to do it. You always use it from below the elbow. And that way, what happens is this muscle group gets tighter and restrained from excess activity. The muscular activity is reduced, inflammation is reduced, and therefore you get support. You also can undergo physiotherapy in the form of IFT or ultrasonic therapy, etc. And in the last resort, you can also look at having a steroid injection, or what you call as a PRP injection, what is called a platelet-rich plasma injection. That's being done now. It's very safe, and I've given it to a lot of tennis players across, and there is no reason why we had to get worried about doing that injection. A lot of questions asked, and this is steroid injection good? What will happen to me if I take it? Now, the key thing is that you're having only one single dose of a steroid injection. That's not going to go into the system for you to have other problems related to steroids and other things. So don't worry about that part of it. Now, in terms of the rackets, this is a big question which everybody asks. Can I change this racket? I bought a racket, it's 10, 12,000 bucks. Now I'm finding I have pain. Should I buy a smaller racket which is different? Whatever it is. Now metal rackets not recommended for players with elbow problems. Okay, and don't use long body rackets if you have elbow problems. So racket heads is that matter. So increase that. The heavier the racket, it increases the torque about the elbow joint by shifting the force away. And therefore, it's not recommended for players recovering from injury. So a heavy racket head means you're dropping your racket arm, and therefore it means more energy, more torque on the hand, and therefore it means more chance of injury. Cushion grip bands, they can also help. They also take away the vibration and torque. I'll come back to that a little later. And that also helps in mitigating the pain and transfer of force onto your elbow, and that also gives you some relief. Any questions on the elbow? Anyone?
The question I had was very simple, that you told about the steroid injections, but how safe is it for somebody who is high on diabetes? Because I know a player who was training under me who had a tennis elbow, but also had very high diabetes, and he was absolutely told not to go for those injections because that would hamper him. Is that true?
No, I would beg to differ on that, because the dose of steroid we're giving is only a 40 or 80 milligrams of steroid. And this is a very, very small dose, and it's a one-shot injection. It's not like having steroid tablets or steroid injections on a regular basis, everyday basis, for various other illnesses like rheumatoid arthritis or some other joint-related problems, which we give steroids on an everyday basis over a period of time. So that is a myth. I think you can very well reassure your trainee that if it's one single dose of steroid, yes, he can go ahead and do it. Nowadays, I'm moving more towards giving what is called as a PRP, what's called as a platelet-rich plasma injection. So you actually aspirate blood from your own self, you centrifuge it, get the platelets out onto it, and then you inject the plasma straight onto your tennis elbow or the heel or to the knee. And these seem to be working a lot better, and they are more biological than a steroid or any other injections. So in that way, it's quite fine. Diabetes and this, I don't think there's a worry.
Oh, great. Thank you, doctor.
Sure. So we go on to the next area of the thing, which is the wrist. A lot of us Indians are classically wristy players, and unfortunately, tennis is a sport where wrist should not be, very mobile. It's a sport where the wrist is, very locked position as compared to a lot of other sports. I think Mayur and Sanjeev and others can correct me in this. So we always talk about having a wrist firm. So one of the things we're talking about is the grips. What grip do we do, and is the grip going to be a role for causing injuries? Yes, most of us in the 70s, 80s group who were taught tennis at the time were taught the continental grip. And as you see, like you can see on the screen, the dial, where number 2 is where the continental, where you hold the racket across in this position. And that was the grip we all taught with, we're comfortable with. The issue with that grip, as we find, is that a lot of people do have tendency to have, a little bit of tennis elbow with that grip in terms of increased force going on onto the elbow. So, and of course, the forehand also was a problem with that. So people moved on to an Eastern or a semi-Western grip. So the more you rotate it, the more you have injuries in terms of the cartilage. We have a cartilage in the wrist called as a triangular fibular cartilage. And this cartilage is a very small cartilage joining the radius, the outer bone called the radius, and the bone called the ulna. And these two, the cartilage is the main area which can undergo a tear for a lot of people. Once this happens, then the wrist becomes very, very painful. And, then you have to use a wrist brace or a support to go on and start playing that. So this then necessarily means that we have to readapt and change our grip into either a Eastern or semi-Western grip so that we can avoid getting injury onto the wrist. So that's one part of the correction which we have to do as we get older. Now, going on into the back, which is the other key area, we find that 80% of us have back pain once in our lifetime. And statistics wise, the second most important reason to see a doctor and the second most reason why people visit a clinic is very high among footballers, gymnasts, and wrestlers, and little lesser amongst us tennis players, because we don't do what we call as hyperextension activity. Hyperextension is arching your back a lot, like what the gymnasts or the fast bowlers do or the swimmers do. So we don't have too much of hyperextension unless, of course, somebody goes into using a big kick serve. So one of the other important things here is 40% of pros. This is a very important statistic which I found when going through this. 40% of the professionals playing on the ATP tour have missed one ATP event due to back pain in their careers. So that's a very important thing. I think people like Federer, etc., have also been away from tennis with that. So what are the common things? People always think about disc prolapse or a slip disc, which is not very, very common in our age group. It's a very common thing in the younger age group, the 20 to 35, 40 group, but not in our age group. The commonest thing is a strain. We're not, as I told you before, our backs are stiff. We are adapting towards not stretching, and therefore we have a strain. The other thing again is our backs are again stiff, and we're trying to extend ourselves to reach out and try to play, and we can have an abdominal injury, which can also be there. So you can have wear and tear in the back, what we call as lumbar canal stenosis, or what we call as degenerative back pain. And of course, as we get older, we also have to look at other causes of back pain, which could be abdominal or could be a kidney problem, or you could also have pancreatic problems and other things which be there. So if you have a persistent back pain, get it evaluated and don't continue to be misled saying is wear and tear or just nothing else. So these are things you have to be looking at in terms of the back pain. And what are the things you need to do for this? So we divide this into both an acute phase and a chronic phase. Acute phase is when you have very severe back pain. Commonly, we find people in our age group saying, "Look, I bent over to wash my face. I couldn't extend myself back. I'm very stiff on that." That's one of the very common things we see, where you have arthritis in the back, just like you have arthritis in your knees and your elbows and other areas. You can get arthritis in the back because the back has also got joints. And that the only way to get to this is to go back into physiotherapy training, work on the core activation and strengthening. So when you look at acute or chronic phase, the key thing becomes controlling the pain, what we call as price. Protection, rest, icing, core activation, exercise therapy, etc. So these are the main things. So control of inflammation by medication, exercise routine, and then you go on to core, 32 core muscles across, you work on the core, strengthening routine like all of us are doing. And other additional point which is not often stressed out in our group is hamstring stretches. Most of us who are able to be very supple and bend, touch the floor, etc., we used to pride ourselves on doing that over a period of time, that we could just reach out to the floor directly. But you find that as you grow older, you can't even reach your toes, you can't even reach your shins. And now, as we find that is tougher and tougher, we find that the core cause of that is the hamstrings. The hamstrings get tighter and tighter. One small test which you do is try lift your legs up into the air straight and see whether you can go 90 degrees into the air. I bet most of us can't do that. And that's because our hamstrings have not been stretched over a longer period of time. And this is the main reason why our backs also give way. So the first thing I advise for most of my friends who are coming is work on the hamstring stretches. Some of the simplest exercises: raise your foot up, put your foot up on a pillow, on a bed or a couch, and then stretch yourself out. And once you do that, you find that you're able to go ahead and make sure that your hamstring is being stretched, and thus alleviates the pain. Avoid running on a treadmill. I'm very clear about it. Over the last 10, 15 years, I've been seeing patients and documenting it. Running on the treadmill seems to worsen your back and ankle for a period of time. The reason being that when you're walking and running, you actually put your back into an extension or you stretch your back across. And that is bad for all of us because the space in the spinal canal becomes narrow. And therefore, you find that over a period of time that as you keep running on the treadmill, you're arching and arching, and that becomes narrower and narrower, and it becomes more and more painful for us. So don't run on the treadmill is my suggestion. Start doing lightweight training. Avoid doing squats, deadlifts, and bench presses for at least 3 to 6 weeks when you have an acute pain. You can go back to it after 3 or 6 weeks. All of us are into sedentary work over a period of time. Avoid prolonged sitting. By prolonged sitting, I mean even sitting for half an hour. If you sit for half an hour or more, you're going to load your back. And when you load your back, that means you're going to put more and more pressure on the back, and that's not good. So after every half an hour, make sure you get up, walk for a minute or two, come back and sit down. More so with people like Rakesh, who've been sitting down in the offices for long hours. So Rakesh, make sure you get up after half an hour. Get up, walk the guy to the door. The guy thinks he's, the MD of the company is walking me to the door. He's very happy about it, and you're also protecting your back. So that's very important to do that. So these are a few small things you need to do as far as the back is concerned. Okay. Any queries on this point of time? Any queries or any doubts with anyone?
No, the admin has told us that we should now hold back and let the flow go on.
Okay.
Everybody's
That's
making
fine.
the notes. Everybody's making the notes and will come in the end.
Of course. That's pressure on me now. Okay. Let's hope I don't choke. Now we come to the area which is in limelight now, thanks to a guy called Andy Murray. Everybody is talking about Andy Murray and Andy Murray's surgery and Andy Murray's back. Now, this has been going on for a very long time. Hip problems are going on for a long time. Some of the big names who have had hip issues and gone out of tennis: Tommy Haas, Gustavo Coutin, one of the biggest names, 3-time French Open champion; Magnus Norman, former world number 1; David Nalbandian, one of the big names; Leighton Hewitt, former world number 1. They've all had problems with the hip. So one of the biggest things that you find with the hip problem, which is actually brought to light by the people, is because they find they're not able to squat, they're not able to move comfortably, and they're not able to bend and sit or cross-legged or do things routinely as what they were able to do. That's the first sign they notice. They say, look, I feel a little tight in my hip. And that's one of the most important things to recognize. So common things which we see in this is you can have labral tear, the cartilage is worn out. You can have tendon injuries, abdominal strains, and of course you can have arthritis in the hip in our age group. Arthritis in our age group is very, very commonly seen because we abuse our hips playing a lot. So the only solution is that you have to keep working and strengthening the muscles around the hip joint, namely the front of the thigh as well as the buttock area, the gluteals. So those most important thing would be work on those, conditioning of those. And once you condition those, you'll find that to a certain way, you're able to alleviate your pain and you're able to balance your hip and go along. Knee injuries, commonest we find. The common things you talk about, people talk about, and knee injuries would be, cruciate ligament. Rakesh has had his cartilage torn and repaired for that. And then, as we get older, we find that these cartilage injuries, the cruciate ligament injuries, the X ligament injuries, they don't come in the forefront. The most common things we find now are wear and tear pains, or what we call as osteoarthritis or degenerative pains. And when you take an X-ray, you find that the joint line is not normal. The joint is narrower on the X-ray, and people say, "Look, your joint is buggered." And these are common things we hear. And apart from this, the cartilage tears which you get now are due to wear and tear, not to an overuse or a strain-stress relationship, which you see in the 20 to 40 age group. Another thing which you find is swelling in the back of the knee called as a Baker's cyst. Baker's cyst is nothing but a fluid accumulation into the fossa at the back, and this is actually a sequelae of a wear and tear happening in the knee joint itself. The knee joint itself is actually composed of 3 bones: the thigh bone, the femur; the leg bone, the tibia; and the floating bone called the sesamoid, the patella. So these 3 bones together make a very complex joint, and this wear and tear can happen either in the undersurface of the kneecap, which is very common in the 45 to 55 group. And then you can have wear and tear in the joint between the thigh and the knee, what's called as the femorotibial or tibiofemoral joint, which could be the inner part of it and it could be the outer part of it. The inner part is called the medial compartment, the outer part is called as the lateral compartment, and this could also be undergoing wear and tear. And this wear and tear can actually become very severe, inhibiting our movement and also making our tennis less enjoyable than what it is. So the other thing which can happen is, because the cartilage injury or the ligament injuries, we could have mild instability in the joint, and these things can be overcome by persistent strengthening, conditioning, and in the acute phase, physiotherapy in the form of heat therapy, IFTs, etc. For some of us who are more painful, we could use external supports or braces. And lastly, of course, rest for a period of 3 weeks to get over this is also done. Surgery is, as I said, is a last resort. If somebody has got persistent disability and activities of daily living are hampered, then we go ahead and do surgery. Surgery is mainly arthroscopic surgery in terms of the cartilage as well as the ligaments. Sometimes we use the arthroscope to debride the joint. The joint has got some debris or wear and tear, and we use arthroscopy as a resort to go ahead and debride it, but then that's not the permanent solution. And of course, somebody who is really, really sick and the joint is really worn out, joint replacement is the only solution. But as as a passionate tennis player and a fanatic tennis player, I would resort to joint replacement as a last point, and that means it's a no return point for tennis. Although people promise a lot of things saying, yes, you can get back to playing sport, etc. It never is the same, because mentally you're worried if something is going to go wrong. Our family doesn't allow us to get back into playing. So therefore, we are forced to say that that will be the last resort. So in my personal view, I wouldn't resort to a total knee replacement for a tennis fanatic. I'll say, wait till you think that you can't proceed. Other thing is, never quit playing, because the disease process is not going to change. It's a wear and tear. Your car is going to run 50,000 kilometers. The 50,000 kilometers is going to have wear and tear. Option is keep running it down to 80,000 till it says, no, I can't go on. Or, you change it at 50 and stop, and then or buy a new car. Buying a new car is not an option for tennis players.
Mm-hmm.
You can't change it. Now go on to another very important area, which is very, very painful for all of us, is the patellar tendonitis. The tendon which attaches itself into the leg bone, the tibial tubercle, gets inflamed. This is otherwise called as a jumper's knee, People who are resorting to a lot of jumping activities. Tennis involves a lot of jumping activities. You stretch for an overhead, you have to jump and hit a volley, and and people like Mayur, they keep you jerking off the court all the time, so you have to jump to reach the ball. You can't reach the ball normally, so tendon gets stretched all the time, and then this gets to an inflammation. So what are the things you do for it? Again, bracing it, using an external support or a brace, which is useful. It's like your tennis elbow support. You have a small strap which you can use on it, and then go ahead. I recommend three very specific exercises to work on that. One is the leg extension curls. You can use it with the weights, or you can use it with an ankle brace. Like, it's a very important exercise to do. The other thing to do is the sit-ups or the wall-assisted sit-ups. Those are very important exercises because you keep the body stationary. And lastly, you can also do the exercise on a inclined plane. You get onto an inclined plane and then lift your leg up, lift your knee in extension up. And these three main exercises are helping in and strengthening the tendon and the muscle which goes on to the tendon. So that way you can avoid reparative injuries. If it's very, very painful, give it a rest. Don't push yourself. Give it a few days rest, 3-5 days rest, and then get back gingerly across. Don't go back like a maniac into tennis again, saying I want to play 3 sets, I want to play 2 sessions and get back into it. Listen to the body. I think as we get to be older, we have to listen to the body. So other extremity problems which we can have is calf pain or calf injuries. Achilles tendonitis, the main muscle tendon in the for all of us, they heal. We can undergo pain, and that tendonitis can be there. Sometimes, occasionally, people have ruptures on that, due to, inadvertently people being given steroids into that area. Now, one of the biggest problems with, a lot of orthopedic guys is that we tend to use steroids for giving quick relief of pain. And one of the things which I strongly say that you should not do is giving a steroid injection into your Achilles tendon, because that weakens the tendon. And I've seen quite a few, athletes coming back with a partial rupture, which means they're out for about 6 weeks on that, and that's a no-no for them. So I would recommend giving a rest, giving a heel raise and a brace for them, so that the pain is relieved. Shin splints are another major issue because we start training, running. So only way to solve them is to take rest or use splint guards. I think the last thing which we look at is what we call as the plantar fasciitis or heel pain. Commonly, in diabetics especially, you get up in the morning from bed, put your feet down, you can't put your feet down, it hurts a lot like nobody's business. And that's commonly called as plantar fasciitis. Solution is have heat therapy, get a bucket of warm water, put your feet in it, warm it, and then go slowly stretch the plantar fascia. Worst case scenario, if your daily work is hampered, go ahead, use your foot, use your plantar, your sole guards. Also, lastly, go ahead, have a PRP injection to alleviate the pain. Most importantly for all of us as we get older, make sure you have a BP under control, the sugars under control, drink a lot of water, hydrate ourselves well, build up the immunity, make sure the kidney functions are good. All of us abuse our painkillers. Painkillers are bad for the stomach and the kidneys. People think that, no, doc, I just had 2 days of painkillers and 2 days of Overon. Let me caution you that even very small doses of painkillers are not good. They can bugger your kidney up, leading to what is called as acute renal failure. So that's something which we don't want to go into. So avoid painkillers unless you have no other choice. Build up your immunity. Have a lot of vitamin D. Get onto the sunlight. Playing tennis 2 hours a day is good. So get onto the sun. Build up your vitamin D and make sure that our general health care is good so that we don't fall sick. It's more so now in these times when Mr. Corona is around. So we look at some general recommendations now in terms of all of us as well as everybody else who's looking at. So should we do warm-ups or what? A lot of us are busy with work and schedule. We drive down, get onto the court, because we want to get that extra 20 minutes of play before we head back to work or head back home. So we forget this important thing called warm up. So warming up is very important. Then people like Ajit and Rakesh and Mayur, who are all playing very serious tournament tennis, it's very important to get into adequate warm up rather than sitting on. They sit for 1 hour, watch your friend play, and then you're called, and then you go back right onto the court. So make sure you don't that mistake and get warmed up adequately. Two things importantly, which I think I had to stress on, is the two things called as static warm up and dynamic warm up. Static warm ups are not good. Now, the warm ups are good to improve flexibility. Static warm up is just when you just stretch your muscle. Like, I see a lot of people, including me, I feel guilty when I don't do a stretch up. So I just stand there and then push my calf up, or just stand and stretch my legs out, hold for 15, 20 seconds. And then I think that I'm doing a good stretch up before going to the court. And actually, I'm doing myself a lot of damage, because a static stretch is not good before a match. You never want to do a static stretch, because you're going to make sure that the muscle is not being put into tension. So you need to do a dynamic stretch. Dynamic stretch for us as tennis players is jogging around the court, doing bicycling, swinging with a racket, and doing all the dynamic motions. Basically, you're putting the muscle under a stretch, under tension. And this is what actually helps us when you're going to play from getting into an injury. When you go into a static stretch, your actual muscle is actually bulky and loaded. And therefore, when you're going to play and push, you're going to extra load the muscle, and that is going to get injured. So avoid doing a static stretch at any point of time. I see a lot of people, including myself, who put their legs up on the fence and do a figure of 4 stretch, which is not to be done. It's not at all recommended, because you're going to hurt yourself more. So do a dynamic stretch. Before playing, 10 minutes, 5-10 minutes, get onto the court, run around the court. You see Nadal, hopping around from the baseline to the net and back and doing things. He's doing it with a reason. That's dynamic stretching. Swing through with your racket, dynamic stretching. So these are important for us. Okay. And then for the very serious guys who are playing the ITF circuits and all of them, I look at this thing called as periodization. And that's very important. So I wouldn't go too much into it, but just the 4 things important: the preparation phase, the pre-competition phase, the competition phase, the rest and recovery phase. So what is it by means in each of this? The preparation phase is the period leading to the rest period, where you do not do much of tennis, but you do a lot of workouts, a lot of drills, exercises, and everything relating to strengthening as well as conditioning. So that is very important. And then you go on to the pre-competition phase, where you're just weeks before the competition, where your tennis-centric exercises and your tennis loading becomes more. And that's very important, because at that point of time, you don't want to do a lot of weight training and strength routines at that point of time and get into endurance mode. The next phase is the competition phase, where everything is tennis-centric, because you're working on tennis, putting more time on the court. And lastly, don't forget it, between tournaments, between things, you go into a rest and recovery phase. You have to give yourself adequate time for rest, and of course, every part has to recover. So there's no point in pushing yourself. Give it time to recover over a period of time, and you'll find that you actually get better performance out of it, rather than having a very standard and then losing interest in playing the tournament. So lastly, going on to rackets and instruments, do they make a big difference? I know Rakesh is here with Babolat. I'm not propagating Babolat or any racket company here. So string vibration plays a big role. So vibration, are 3 kinds of vibrations there. String vibrations, which are negligible. Oscillation of the racket frame itself, which is important. And then the most important thing is shock jar syndrome, is the main cause of tennis elbow, hypothetically. So this shock jar syndrome is when somebody hits the ball and the ball reaches into your racket head, and from the racket head, the impact travels onto the elbow. So how do you reduce this? So make sure the ball stays longer. One thing, grip your racket loosely prior to contact, and then go on to a generalized statement. There's a racket that is heavier, moderate weight, moderate tension, and is held loosely before diminishes the impact and therefore diminishes injury. So therefore, tennis rocks for all of us, and I wouldn't be doing what I'm doing and meeting all my friends, having a great time with all these guys here, but for tennis. Thank you guys again. Thanks, Ajit and Rakesh, for giving me the opportunity to say hi to you guys and share whatever little I
Thank you
know.
so
on
much.
this. Thank you very much for all these lovely days which you guys have given me on the courts.
Yeah.
So now can we start the Q&A
Sure.
session?
Yeah.
Yes,
Okay.
definitely. We should go ahead with the Q&A session. The first question is from Mr. Jyoti. Yes, please. You can go ahead, Mr. Jyoti.
Okay, doctor, I have a question. I'm suffering from a hamstring. So I just need to understand whether this hamstring pain even goes to the hip and maybe sometimes to the knee also. If yes, what exercises do you suggest in this lockdown period? What I can do?
Okay, the hamstring pain, when you say hamstring pain, you mean pain in the back of the thigh.
Yes.
Am I correct?
Yes.
So,
yes.
did you contract this while playing, or was it just incidental?
It was while playing actually. Yeah.
Okay. So when you were playing, actually, what happens is you could have had a partial tear, or you could have a blood clot into your hamstring muscle.
Mm-hmm.
If you feel the back of the thigh, you'll find a sore area on that, and that is probably because of the hamstring injury which you had, either in the form of a partial tear or in the form of a stretch in the hamstring muscle itself. So
Okay.
the thing for that is, in terms of going in, is doing a hamstring stretches, doing what we call as prone, lie down prone, and then do the hamstring curls and the hamstring stretches on it. These would be the main things which will be important in terms of doing it in the initial phase for the first 2 to 3 weeks or the 3 to 6 week period. And at the end of it all, it's very important to go ahead into the gym and do the hamstring strengthening exercises using light weights as well as the elastic resistance bands. So do not increase your weights, increase the repetitions gradually till you find that you're able to stand on your toes as well as sit on the floor and reach out to your toe. If you're able to reach out to your toe by lying down without the hamstring paining or hamstring being stretched and leading to a pain, that means you're on the road to recovery and you're back to playing tennis normally.
Okay, great. Thank you. Doctor, one more question is, it's a bit confusing, right? So let's say if you really want to do stretches, so do you you need to have a warm-up before doing some stretching?
Yeah, see, the question is what kind of stretches are you doing and when? The stretches when you're doing before you begin your training session is what we call as static stretches. And that shouldn't be done, as I explained to you, before a match.
Okay.
When you're going for a match, you want maximum loading and maximum tension on your muscle. That is brought about by doing what is called as dynamic stretches.
Okay.
So dynamic stretches are brought about purely by running, by cycling, by jogging, or by stretches with your racket, etc.
Yeah. Last, I'm so sorry. I think this will be a helpful question for everybody. If you can throw some light when to use cold packs and when to use hot packs.
Okay, there's a big issue with this. A lot of us are also actually as confused as what you guys are. One of the recommendations when I go through the literature, the scientific journals coming out, is using of a cold pack is ideal in acute settings, as it reduces trauma, as it reduces inflammation and swelling. Using a hot pack at that point of time actually causes increased permeation, and therefore it is not recommended. So in an acute setting, icing is better. In a subacute or a chronic setting, it doesn't really matter.
Sorry, lost you.
Can you hear me now?
I can
Yes, we can hear you now.
Yeah. So you could use either of them depending on what individual conveniences are. For example, I like to use a hot fermentation as compared to an ice pack when I have shoulder or back pain or whatever. Some people are very comfortable with the ice as compared to others. So in a chronic situation, it does not really matter which one you use. In the acute situation, yes, scientifically, ice packs are recommended as compared to horse packs.
Okay, good. Thank you, doctor. Thank you very much.
Sure. Thank you.
Thank you, sir, for the nice explanation. Yeah, next question. I'll be taking everyone one by one. Mr. Punnusamy, please. Yeah, Mr. Punnusamy, you have to speak out. I'm unmuting it, so you need not do anything. Yes, can you go ahead? No, I'm not able to hear you. Yeah, let me take Mr. Mayur in between and then I'll connect you back. Yes, Mr. Mayur.
Hi, Doc.
Hi, Mayur.
Okay. I know I've already spoken to you, but I need to speak on this forum also because similar questions, a lot of people have it, and this will clear out a doubt for a lot of people. So as most of you are aware that I have been having a bit of a knee issue, and in couple of matches after reaching the finals of the ITF, I had to concede the match because of my knee injury, which had become inflamed during the tournament. And I've been doing regular exercises and everything for it. Now, when I'm doing everything else, of course, when you meet doctors and all, you are given different opinions by the doctors. So one of the things that I need to discuss with you is we have also been given that future of all the injuries is stem cell treatment. And now that it has come into India, how useful is stem cell treatment for knees when it is a degeneration function, osteoarthritis function, cartilage loss function, tear of the meniscus problem, and patella tendonitis issues? Does that help?
Okay, to put things in perspective, stem cell therapy is still very, very experimental. There is no scientific evidence till date saying that stem cell therapy per se can reverse degeneration or arthritis. Okay. Now, there are some variations being used and tried in younger individuals, in younger people who have got mild cartilage deficiencies in the knee. And this is what is called as chondrocyte transfers or chondrocyte grafts. Chondrocyte basically is a cell which you take from the cartilage. And this, when you take it from the cartilage, you are then growing it in a medium outside and injecting it or putting it through a arthroscope into your knee into a defective area, with the premise that this defective area will be, healed over the chondrocyte growing in that area. Now, again, this is all again very hypothetical. There are no consistent evidence being proven saying that we have got 100 people who had chondrocyte transfers done, who have got 80% have been all right, 20% not doing all right. It's all anecdotal, and each one wants to do a different way so that he becomes popular in what he's talking about. Stem cell injection per se into the degenerate area in all of us as senior veteran players is not a healthy thing to do. It is experimental.
What about PRP?
PRP is perfectly safe. PRP is perfectly safe.
But
I would
can it
recommend
work
it.
into this area of the knee where I just spoke about?
No, it will not. It will not regrow anything. It reduces the inflammation. It reduces the wear and tear in that local area for some time, and gives you a sense of well-being. And you then go ahead and then start doing more and more exercise routines. Increase it. Build the bulk around your knee. Work around the muscle around your knee, the quadriceps and the hamstrings around the knee. Strengthen that. So what it does is then it takes the load away from the knee. The muscle gets stronger, the loading goes more to the muscle. When you load the muscle, you actually then allow the knee to rest a bit. Therefore, you alleviate the pain. So we are not changing the disease process.
Okay. And what about injection syn-wise that they recommend you for the joint?
Correct. Synvisc injection is a injection which is a hyaluronic injection, which is supposedly helpful in a lot of people who got arthritis. I don't use it for any of my athletes. I have used it in some of the elderly patients who are 70, 70 plus, 65 plus, especially ladies who are waiting to go through a knee replacement surgery. They want pain relief. So I've done that. But I don't, again, for us as players, I don't recommend that. A single-use injection of a Medrol, like you're saying you're going to play the World Championship, this may be the next year you don't want to play the World Championships, the last year you're going to be in, and you think you've got a good chance to win, and you say you got 3 weeks to get to be fit and be pain-free, I'll give you a steroid shot for that.
Okay.
I wouldn't.
That would stop your tennis post the effect?
It wouldn't, because what happens is then it gives you a sense of well-being, and you push yourself more than that. So you're likely to enjoy yourself more. So if you tell me the last time you're going to play the finals, I don't want to play anymore, I don't want to play any more tournaments, do something about it, I'll say yes, you got a chance of winning. For India, I'll do that.
Yeah, but I need to play till I'm 70.
Then I wouldn't want to do it. I would rather that you enjoy your tennis, rather go through a steroid and then struggle after that. Yeah. Repeated aspect, people get fluid collection in the knee. That's another serious thing which you talk about.
Yes, I've got that. The Baker cyst.
The Baker cyst is the back of the knee. In front of the knee itself, you had fluid collection. People have seen, Ajit probably would have seen Nirmal, my partner and my good friend in Chennai, having these corrections in the knee and struggling with the knee pain when playing in Chennai last time. And a lot of guys put a needle into that and then aspirate the fluid out of it to give them instantaneous relief. Yes, you can do it once if you have one, but then I would not recommend doing it on a regular basis. You have to go back again to the physiotherapy, get strengthening done and work around on that rather than look for quick fix methods.
Great, sir. Can we take the next question from Mr. Ponnusamy, please? Yes. Can you hear us, Mr. Ponnusamy? Okay, probably some audio issue from his end. We are connecting Mr. Vijay Gogoi for the next question. Yes, Mr. Gogoi.
Hello, doctor. So I have a problem of what they call golfer's elbow instead of the tennis elbow. Yeah, and then at the same time I get pain in this at the wrist, and it's been there for quite a while. I've done a lot of strengthening and all that. It's still not, still not healing. So I don't know what could be the potential issue.
Oh, the main issue is because your arm is going into an extension when you're serving. It's probably that your arm is going into an extension, into opening out when you're serving. So you would probably have to, look at, try and reduce your opening out on your shoulder and on your elbow. So that's what's probably causing the stretch on the tendon over here and leading on to pain. The golfer's elbow is epicondylitis on the medial side as compared to tennis elbows in the outer side. So the solution is only reducing the valgus extension. This is taking the arm outwards, especially when you're hitting a forehand, especially when you're hitting a serve. When you're opening out and on your serve. So try to reduce that. Try to modify that action a bit. That will be helpful again. Again, using a support system, an elbow contact support for the thing could also be useful for you at that point of time. Anti-inflammatory effects, medicines for 3 to 5 days will also helpful. That's one. Lastly, also check with your dermatologist or with your physician if the nerve coming down, what's called the ulnar nerve, is getting stretched or whether it is tender and whether it's getting inflamed. Occasionally, for some people, that nerve gets inflamed and tender, and if that nerve were to be done, then you need an injection in that area to reduce the inflammation in that. So that's also one possibility which you have to check with your local physician as well as the dermatologist. The nerve is being thickened, and then you need medication for that specifically.
And does it anything to do with the pain in the wrist?
It's a referred thing. See, the whole thing is based on something what we call as the kinetic chain in the body. The kinetic chain is something which the whole sequence of events happening from lower down on to your upper extremity. And similarly, when you hit the ball, it starts off from one end going to the opposite end. So a part of the kinetic chain in the elbow is broken. That leads to a referred pain onto the wrist because you're trying to compensate for that by arching your wrist or by angulating your wrist. And that's the reason why your wrist is going into some kind of pain. So address this first, you'll find the wrist pain goes off automatically. Again, going back and doing a little bit of strengthening for the elbow and the wrist using light weights or resistance bands will also help you in that.
Okay. Thank you so much.
Sure. Good luck with your thing.
Thank you.
Mr. Rakesh Kohli wish to add some point into it? Yes, please.
Sure.
Yeah, Dr. Karthik, we just heard you, and it was, we all learned quite a lot through your presentation.
Thanks, Dr.
One point which you mentioned was that the mind needs to listen to the body. I mean, all these years, when I started playing the seniors tennis in 2005, I had major issues with my knees, and I had severe arthritis. I went to all the top doctors, Dr. Ashok Rajgopal, Yash Gulati, everyone in Delhi, and they all advised me not to play competitive tennis. And that is a time, when I learned that it is not the body which needs to learn to the mind; it's the other way around. And it's the body needs to listen to the mind, not the other way around. I mean, you said that we need to listen to the body, but I tried it the other way around, and it was quite helpful. And I have been playing tennis all across the globe. I have played more than 100 tournaments thereafter. So, what is your take on this?
My take is exactly the same as yours, but only thing is we are looking at the phases. In the acute phase, listen to your body.
Yeah.
When I
had the surgery, the knee surgery, and I thought that I'll not be able to run again. Then I had this physiotherapist in Delhi. He's Mr. Clark from Australia. And he advised me that I have to run. I said, I cannot walk. You want me to run? He said, no, it's my responsibility. And then in the next 30 seconds, he actually made me run. And then all of a sudden, what I realized was, yes, my body can do it. So, I mean, this is the kind of realization it comes when your mind is strong enough, the body actually listens to the mind.
I entirely agree with what you're saying. I'm not denying that part of it. But what happens is, when an acute phase of injury, okay, when supposing you have, let's say, for example, you have a acute injury on your knee, a tendinitis is there, okay. At that point of time, you have to reduce the inflammation.
That's right.
So that's the time you listen to the body and say, yes, my leg is inflamed, my knee is inflamed. So I'm going to give it 3 to 4 days of break. Okay. Now, there are a lot of doctors who are not sport-loving doctors. If you go to an orthopod, it's not necessarily the orthopedic guy is a sport-loving orthopod or a guy who knows something about sports medicine.
That's right.
A lot of orthopedic surgeons are pure orthopedic surgeons. We know how to treat a disease process as disease. We know how to operate for a disease process, and we are done with that. There are some of us who are interested in sport, who are passionate about it, and who are also into the intricacies of sports itself. Yeah. So some of us, I don't. For example, somebody comes to me with a back pain and says, I'll tell them, okay, 3 days of rest, and you're getting to go back on the court again. You're not going to lie down. We are very particular about it because we wanted to push further. That's when the mind takes over. So the mind then says you can do it, then you can do it. So when you don't have the mind also tells you your knee is hurting, don't do. It's like, if you take a glass of water or a cup of coffee is very hot and you sip it, it is very hot, don't do it. So you wait. So then the mind is conditioned. Every time you have a cup of coffee there, you want to wait till it's quite a little colder. So now it's a conditional response. So you overcome the conditional response by the mind telling you, yeah, you're better now, you go on, keep moving. And that's fun. That's something which you have to go through. That's what you've gone through.
Yeah. My next question is to Mayur. See, I remember Mayur when you were in Helsinki and we had a discussion on phone, and you said that I have played some of the best players and it's too much for my body now, and I cannot take it anymore, and I want to return back. And that is when I suggested that you stay back. You have 2 days in between. What was it that you did during these 2 days that you could come back so strongly and reach the finals of the World Championships?
I think, what doctor also in between said that, you got to give yourself enough rest in between. So what happens is, especially when we are playing a tournament and the end of the tournament, when you played matches, say 7 to 8 matches in that week, your body and your mind, you're physically and mentally both tired. And you need that little bit of time first to rest it out and freshen out. So, of course, those 2 days that I got in between, one was a total rest period I did. Secondly, being in a new country, I just took the air in of that country. And in those 2 days, I actually took a good care of my nutrition. That means I took proper breakfast, proper lunch, evening snack, dinner, and rejuvenated my body. And I think these things helped me to play the individuals in the second week.
But most importantly, I think it was the hunger that all of us sports people, when we are getting ourselves on the court, whatever the condition it is, if you have the hunger to win and you have the hunger to play, I think you can achieve it in under all circumstances. And fortunately, in those days, I was not physically injured like my current situation of the knee, which is hampering me. I was absolutely physically fit. It was, I think, more fatigue, physical and mental fatigue. And I think that rest helped. And then, of course, when more Indians and, of course, you and Ajit ji joined me and sort of gave me a lot of positive talk and all that, the positive thinking also helps you in the whole thing. So I think that's what mattered.
So, okay, my next question is to, thank you, Mayur, thank you so much. My next question is to Sanjeev. Sanjeev, we were watching you at the World Championships in 2008 in Turkey, and you were playing your match, your singles match, and me and Ajit, we were outside, we were watching you, and we thought that, of course, you have had that back injury at that time, and we were aware that you're not going to last the entire match. What did you decide when you actually, I mean, what was in your mind when you actually stopped that match, and how could you come back again the very next day to play the doubles? I mean, I know that you said that you wanted to do it for your partner, but what, I mean, how exactly you could come back to court the very next day and play a very fine doubles? Sanjeev, are you around?
No, he's around, but his audio is off.
Oh, so I'm so sorry about that. Ajit, can you
admit? Can you put Aisha's audio on, please?
Yes, I'm doing this. So sorry. As the name was, I'm keep forgetting, and then that's like.
He's in Aisha.
Yes.
Yeah, that's my daughter's name. Actually, I haven't. It's her computer I'm using. Rakesh, to answer your question, the fact that one went all the way to Turkey to play the World Championships, and I got injured in the singles. I didn't want to concede the doubles, and frankly, it wasn't for my partner. I had an Austrian partner. I mean, it could have been any partner. It was actually for myself. Even if I had to be selfish about it, I have to be frank that I did it because I went there. I wanted to play. I don't think my partner would have been upset that I conceded the match because I was injured, because injury is part of playing. I took a steroid shot, so I went to a doctor and took a shot that evening. And that's how I was able to come. And like the doctor was saying that you take it for temporary relief, and he can give it a steroid shot, like Dr. Kailash was saying. Similarly, I just took it just as a well-being for the doubles, and that's what got me through. If I hadn't taken that shot, there's no way I could have played. You know. And I just want to come in here. Sorry, you finished?
Yeah, please go ahead.
I think I can speak for the entire panel here and all the people who are listening that. I want to compliment the doctor, because being a tennis player like us, he can relate to injuries better than most surgeons and orthopedic people I know in Delhi, because I find that predominantly they are into being knife friendly. They rather they recommend surgery. I've had orthopedic people recommend surgery to me, but he always says, as he said today, that several times, that surgery is the last resort. And don't quit playing. So I think that's very refreshing to hear. I want to thank him for that, because it's the kind of you can say the lines we want to hear as tennis players. We don't want to have surgery because we know how risky it is. So thanks for that, Doc. And just to take up further from the questions I had for you earlier on these tendon tears that I have on the shoulder. Would you recommend a change of racket, any particular racket from which is a little more user-friendly for my shoulder? And would you, the second question to that would be the kick serve, which you talked about. Now that's, of course, bending the back more, but would that be, could that have an adverse effect on the shoulder?
Well, you do put a lot more load on the shoulder when you're trying to go for a kick serve.
Right.
You do put a lot more load, so it's possible that you avoid doing that for some time at least.
Right.
Till you find. See, one of the ways which you could easily do is, as far as the racket's concerned, I prefer, personally speaking, I prefer using a little lighter racket as we get a little older with a larger head size.
Right.
That is more forgiving for us. That is one thing which I have noticed. But then, it again depends on how comfortable you are with each of the rackets. A little head-heavy racket is not an ideal scenario, again, because there will be a drop in the arm. So that again puts load on the shoulder. So to again go back onto it, the first thing would be looking at modified service motion for you. Second thing would be to looking at seeing whether you can avoid hitting the kick serve for a temporary period of time to reduce the load on the shoulder. And then, of course, not playing singles and doubles continuously. Play doubles more often now. Before you come back into singles, maybe take about 3-6 weeks time before you start coming back into playing singles again. Because singles, again, you're serving more often,
Right.
so you don't get a break.
Right.
That's what I would suggest.
Thank you.
Can I suggest something here?
Sure.
What I would say is use a lighter racket, as Doc has suggested, and probably slightly bigger head than what you're currently using.
Right.
And what I had done when I had I had some elbow issue also, is kick serve becomes a bit of a problem. So what you do is go towards slightly sliced and flatter serves, but and cut down the speed and work more towards the angles. The moment you start doing that, your effect of the serve will be as good as what you were doing earlier without putting any pressure, because slice serve again takes a lot of pressure off your elbows and your shoulders, because it's a much more natural action that you go through rather than putting your hand too far back for a kick serve or bending your back too much. It is more you can just stand straight and just loosen your serve out a bit and work on the angles. I think it's going to be as effective, and your tennis is not going to be affected. And this I can tell you from my personal experience as a player who has been playing for probably last over 50 years more, that I've gone through an injury in every part of the body, and you come out of it by just making a subtle change for some time. You strengthen your body again, and you go back to your normal tennis.
No, Mayur, thanks. I appreciate that. You got a very good point. Just to add to that, I also think Doc and Mayur, perhaps the slice serve is what I actually have been implementing a lot, is perhaps also tossing the ball a little more in front, because that's a little more easy on the slice, and while you obviously compromise on the topspin, because you can't do too much topspin with a toss more in front as opposed to behind your back or with that kick serve. But at least I play on grass, so I suppose it also helps you to get to the net a little quicker.
Slice is going to be better when you play on grass.
Huh?
Slice is going to be better when you play on grass.
Yeah, you're right.
The ball is going to stay much lower, and by throwing the ball forward, it's much easier to move into the net also.
You're absolutely right. You're absolutely, except the slice serve on the ad court is more difficult on the backhand side of a right-hander. I mean, it's okay down the middle, but
the other thing, Sanjeev, what you can also do is, there are something called as cyber power mechanics, where you can measure your strength on the shoulder. I'm sure if you go to the Safdarjung Sports Center, they have the machine over there to check how much of abduction and how much of movement you have on your shoulder, and what's the muscle strength in each of them. Okay. So once you do the baseline value and then you keep working, see, we keep thinking that we're doing exercises but not building up enough strength. But actually, we may not be doing it the right way. And therefore, we're not building up enough. So once you have the baseline value noted on, and then you go back in, say, 3 months down the road after doing the exercise, see whether any change has happened. Sure. That's one way of doing it. The other way of checking it out, also ask, very simple thing, ask your daughter, your wife, or somebody at home to measure the girth around your shoulder. The musculature, the girth around your shoulder. You measure the size of the shoulder, and then see 3 months down the road whether any changes have happened. So that will give you an indication whether your workout is actually doing, your shoulder strengthening is actually doing any good or not.
Well, this lockdown is putting on weight in the other areas. I hope it doesn't have the same effect because of the food on the shoulder.
Well, we had to find some way of diverting it to the shoulder.
Thank you.
Right.
Great. Going forward to the next question, can we take Mr. Akhil Mathur in the line? Yes, Mr. Akhil Mathur.
Right. So a very simple question and very generic one. I'm sure it's not. Since I haven't had serious
Mr. Mathur, we are
injuries.
not
The
able to
only
hear
thing
you.
that hi, how are you, sir? How are you doing?
Very well,
So,
Akhil, we're losing you.
The only thing that I wanted to learn is
How?
I think we have lost his video and audio.
Yeah, so I think his network issue. I'm connecting with the next question.
I feel that my body, maybe that is.
Yeah, Mr. Akhil, are you connected?
Yeah, I'm here. Let me know if you can hear me.
Yes, please go ahead.
Okay. So, Dr. Karthik, the question is for you. I have noticed, as you mentioned at the beginning of your talk, that as I am approaching 45 plus, now I have crossed 45. I feel that I am losing some of the muscle mass that used to be there, that I used to take for granted. That even though I was always thin and lean, but I'm getting niggles and injuries and strains more often. So what kind of regimen do you suggest to overcome or at least mitigate this?
Yeah, see, I think as I mentioned to talk, as we grow older, it's a very surprising thing that 25-28% of muscle mass is lost. So the only way to manage it is to do strengthening exercises. So the commonest area which we lose muscle mass is the calf and as well as the thighs. These are two main areas which we lose. So we definitely have to look at strengthening that. And then additionally also the gluteal muscles. Gluteal muscles also for some reason undergo some amount of wasting over a longer period of time. So that's something which we have to look at and address this. So once we address these core areas, the rest of the things actually come into play. So a lot of strengthening routine with light weights, multiple repetitions, to start with doing on alternate days. Do 1 day for the lower extremity, back, another day for the upper extremity, chest and abdomen, so that you give adequate recovery time for the muscles to recover.
Great, sir. Can you connect with Mr. Navneet Malik next? Yes, Mr. Navneet.
So my question is regarding I'm having an acute vitamin D issue. So it reached 3 once, and average, despite my best effort, has not increased 10. Is it okay to take supplement, or should we be really dependent upon playing in the sun? I actually am allergic to, my eyes are allergic to sun, so that creates a bit of an issue.
Okay, what was your primary problem with the vitamin D? What was the values?
3, sir, at one stage.
3.
I have been able to recover it up to 10, but not beyond that.
Are there any kidney issues or any other
No,
things?
sir.
Have you been tested
No
for
other
kidney
issues.
and parathyroids?
Yes, sir. No issues, sir.
No issues with kidney and parathyroids?
Yes, sir.
None at all. Then,
yes, sir.
then I think it's important for you to go on supplements straight away. If it's only 10, it's not acceptable. You will have to go on supplements. For that, I would suggest that to get some basic blood tests done to assess the renal function and the liver function. And I also would like to have something else checked, what's called as a hydroxycholecalciferol. Hydroxycholecalciferol. Okay,
Okay,
you can
sir.
note that down.
Right, sir.
It's a blood test done.
Right, sir. Noted, sir. Thank you.
Coming to the next 2 questions, I'll be reading out because the audio was not possible from the participants. So first one is from Mr. Punusami. What kind of stretch activities needs to be done post game?
Post?
After the game.
Definite cool down exercises have to be done. Basic stretches have to be done. And if you're playing a long match and you're very sore, it's good to have it's good to have what is called as an ice bath.
Thank you, sir. Next one is from Mr. Prashant Bhatkar. He thanked for the amazing session. Some supplement, what kind of supplements that you suggest for the players, senior players?
I'm not in favor of any supplements for any of us. in terms of the so-called market-driven protein supplements, etc. The only supplements which I would suggest is for us is using vitamin D supplements or calcium supplements. Those are the only things. And no, adequate dietary intake. You can have a chat with the dietitian who will give you a breakdown of carbohydrate, protein, fat content, and then give you adequate thing. Before a match, during a tournament, it's good to have a good carbohydrate intake. If you're looking at weight reduction and things like that, then you're looking at a low carbohydrate diet. So it depends on what scenario you're looking at.
Great, sir. Thank you. Last question from him. Being he's an optometrist and vision trainer, so are there any role of vision training for sports, especially in tennis, that he used to know?
I'm sorry, I'm not aware of it.
Okay, great.
Maybe Ajit can add a word on that.
Yes, I am connecting with Ajit sir. So Ajit sir, there is a question. What are the roles of vision training in tennis player?
Can you unmute me, please?
Yes.
Yeah. Am I
We
audible?
can hear you, Ajit ji. We can hear you.
You know, in other countries, optometrists are part of every sports team because vision training skills and vision enhancement, reflexes enhancement is a very much part of athletic, any athlete. So improving your reflexes, there are certain lots of exercises, there's specific courses, or they're specifically trained program, which we call them sports vision. And we have sports vision clinic in some developed countries like United States and Australia, where one can work on the eye reflexes, eye movement, and improving them. So we have a lot of role to play, but India, it is still at the very low stages. And we work quite a lot on the athletes for improving their skills for vision, reflexes, and vision improvement. People using glasses and playing, I strongly suggest they should use contact lenses to play. I recommended the same to my partner Rakesh Kohli, and he always uses contact lenses. It improves your reflexes, it improves your skill, it improves your injury chances, that you will not get injured with sometimes the ball can hit you on your frame and it can give a lot of damage. So avoid playing with your contact lens, with your glasses while playing tennis too. So just these are we have a lot of scope and a lot of area where we can chip in. Thank you.
Ajit, on this question, can I ask you something?
Yeah.
As we get older, we have progressive lenses to be used. Okay. So now, do you recommend playing with a progressive lens, or do you recommend playing only with a myopic lens?
No, only glasses what you use for sports is distance vision glasses. Progressive glasses cause interference in when you are going to hit the ball. You tend to look at from a near zone. So avoid using progressive for tennis because it will give you different perception, different depth of the ball. So use only distance glasses. Otherwise, as I mentioned, use contact lenses only for distance, and you will be very good with those.
Yeah, Ajit, I mean, your suggestion was quite helpful. You know, when we were playing in Finland, and you could see that I couldn't spot the ball in the singles. But when we came out to play the doubles, and I was already, I mean, you recommended the contact lenses to me, and you actually put them on for the first time because I didn't know how to use them. And then when we played the doubles, we came out quite strongly. So I think that was very helpful. And on a lighter note, Ajit, I would just like to ask you another question. When we were in Mallorca, and you know, we were just on the courts, and there were some youngsters who were there, and they came around and they looked at your muscles around your calf and all, and they asked you that how did you get them, and you replied that we get it into the malls. When you get to the malls in India, we get them there. How do you build these muscles?
Well, I think this question is being asked to me anytime I go and play tennis in any part of the country or any part of the world, that how did I develop it? I think it's just more of working on those and developing them, and with God's grace that I've been having good strength in my legs. Only thing is that you need to continue to work, start cycling, start doing some exercises with strengthen, and that's what Dr. Karthik stressed, that more than anything else, the key lies in strengthening the muscles around the area of the injury. I think that's what I would suggest to everybody too.
Okay, Mr. Jit looks like to add some points. I'm connecting him. Yes, Mr. Jit.
Hi, good afternoon, everyone. Thank you so much. Hi, Doc. Really nice listening to you. I have a personal question that I wanted to ask you. I had a slip disc. It was a PID way back in school. I was into gymnastics. I was into football. Then I had gone skiing one particular year to Gulmarg. And thereafter, I developed a PID, which is a prolapsed invertebrate disc, which I'm sure you're aware of. But I'm actively playing tennis now, and I've been playing the ITF circuit also. My questions were, what do I need to take care of? Because there are times when my body tells me that, look, it's time to take it easy. And I take it, then I tend to just get out of the court and I take a break for a few days. I also do a lot of long drives, doctor. So when I drive, I use a cervical belt. Now, my question is that advisable? And what should I actually look out for when I'm playing? Because I play every single day, if it's possible at all. And now I've been actively playing with the ITF circuit as well. Thank you.
Perfectly fine. See, I don't think you have to worry about your slip disc from your yesteryears, because that would have healed by itself by now, and it shouldn't be an issue at all. Okay. Now the only thing to be concerned about is avoid hyperextension. Especially when you're trying to serve. Now arching your back across and trying to get that extra pace or extra kick on the serve can actually lead to a little bit of pain. That is something which you can try and avoid. Work on the core abdominal muscles. That's a key thing. Two areas which you really have to keep working on is your ab strengthening and your hamstring stretches and strengthening. Those are two core areas which you have to keep on maintaining.
I exercise, I do my back extension and I do a lot of my ab exercises as well. Yeah, I do that on a regular basis.
Add the hamstring stretches and the hamstring strengthening along with that. And if you're going for prolonged long drives and you like it, drive for an hour, but then take a break after about 1 hour. Stop your car for a minute.
I do almost like a 10 to 12 hour drive because I drive towards Kathmandu where my wife is from. So, I do very long drives, sometimes that stretches. And I do this at one single stretch, doc. So, I just wanted to ask you, that's all right, is it?
But what you do is, stop the car after an hour, get out of the car
I tend
for a minute or two, stretch it. Make it a habit at every hour you do that.
All right, doc. And my second question, yes, okay.
Yeah,
I'm so sorry.
Causes the most amount of stress in the back for all of us.
I see, okay.
So prolonged sitting is even half an hour is prolonged sitting. So avoid that.
All right. My other question was with regard to the shoulder. When we are doing the shoulder, there are times I've noticed that, when I play excessively, when I'm through tournaments and there's a lot of repetition of matches, day in, day out, we have a couple of matches in a stretch of 4 or 5 days. I noticed that while sleeping, your hand tend to get a little numb at times when, a loss of sensation at times also.
Your fingers.
Yes, in the fingers, yes.
Yeah, that's probably because the position in which you're putting your hand in and lying down. So there is a partial compression of the nerve happening at that point of time. It can be habitual and it can be positional. So that's the only reason why. If it's not persisting and permanent, forget about it.
No, not really.
Forget about it. It's purely positional. It's like, what we call as a Saturday night palsy. People are sitting in the bar and the clubs playing cards.
True.
You sit in one position like this and you're playing cards all along. This nerve gets pinched on because it's under pressure. The nerve is over here.
Okay. Yes.
It's pinched on that. And that similar thing, like when you sleep lying down like this, your hand is almost like this. So probably an odd position stretching the nerve, leading on to a pinch effect. If it's transient, ignore it. If it's permanent,
all right.
You do nerve conduction.
Just before I leave, would it be advisable for all of us as senior players now, well over 50 now, to take a regular supplement of vitamin E also, doc? Vitamin E, I believe, is good for us as players or sports people.
Yeah, vitamin E is quite good. Apart from that, for people, a lot of us also have calf pain either in the evening or at night times. So an addition of something called as levocarnitine. Levocarnitine is
yes, levocarnitine.
Yeah, carnitine. So the Evion comes as vitamin E is now commonest brand is Evion. It comes as Evion LC. So addition
LC.
of that vitamin levocarnitine for all of us.
With LC, okay.
Yeah, it seems to be helpful. Like, take it for 3 weeks, give a break, then take it again. Seems to be very helpful.
All right. Thank you so much. And just before I leave, congratulations to all the gentlemen here. I think Rakesh Kohli ji, I think Dr. Bharadwaj, who I know personally, we play sometimes in tournaments. Hats off to you all for representing the country in the ITF, and best of luck to all of you. Please stay healthy. Please stay safe. Thank you.
Thank you so much.
You too.
Thank
You too.
Thank you. Thank you. Thank you so much.
Wow, that's a great session. I think we have taken up all the questions which are there. Now it's up to the panelists to sum up the meeting. Over to you.
So I would like to take this opportunity now to first thank Dr. Karthik to come on and give us these helpful tips. In short, that if I'm wrong, kindly correct me, Doc. What doctor has told us is that as age progresses, we keep losing our muscle mass, and that also is one of the major reasons why we get into injuries. Secondly, is that we need to keep working on our muscle mass and now work even a bit more because we are losing the muscle and strengthen our body. And we cannot help the degeneration happening into our body, but at the same time, we can delay the degeneration by strengthening the surrounding muscles. And most importantly, avoid surgeries, keep it as a last resort, and don't stop playing. Keep playing till you drop dead. Is that right, doctor?
Absolutely. Dead on.
Thanks a lot, doctor.
It's as sharp as yourself.
Thanks a lot, doctor. And of course, a couple of us who have known you for a long time are going to always take the opportunity of misusing your guidance and keep bothering you and keep taking your advice.
It'll be my pleasure and privilege. You guys are all
Thank you,
welcome, and I hope that we will all play in Chennai sometime. And I think we will look forward to maybe having an interstate senior, a senior state championship like what we used to have for the men's long back.
Yes.
The men's long back we used to. I remember maybe we all used to play the men's interstate, and that's been defunct now. But now I think we probably would like to do that for the veterans at some point of time. So we look forward to it, and I wish to thank the panelists and then Rakesh and Ajit especially, and Rakesh especially for organizing this and giving me an opportunity to interact with all you guys and saying hi to all you guys in these stressful times. All of you guys.
Thank you.
Thank you.
Although we would like to continue this on and on, but I think all good things must come to an end. So I would like to sum up, and I would like to thank Ajit for conceptualizing this idea of getting all of us together. And I would like to thank Dr. Karthik Kailash for bringing in such great insight into the entire thing of physical fitness for seniors, senior tennis lovers, and educating us on how to keep ourselves fit. And I would also like to thank Sanjeev for his inputs and for moderating the session. And I would also like to thank Mayur for bringing in his insights into what top level senior tennis is all about. And I would like to thank all the participants. And of course, a big thanks to Oli for being such a great help to organize all this. Thank you guys. All of us have been quite good today, and keep yourself fit as per the advice of the doctor. Thank you so much.
Thank you so much. Thanks, doctor.
Thank you.
Thanks,
Thank you.
Karthik.
Stay safe. Stay
Very much.
safe.
Thank you.
Take care.
Thank you.
Bye.
Thank you. Bye-bye.
Bye.